Every one of us in the room will experience a health challenge or support someone who's going through that. And after you've dealt with the diagnosis, the prescriptions, the appointments, the follow-up, the one thing you'll want is to talk to someone else who's been through it, who understands where you are, can tell you about the journey ahead. The power of our collective knowledge, the wisdom of the crowd, can be leveraged. I'm Lynda Brown-Ganzert, and I'm the founder and CEO of Curatio. And along with my very smart team, we are on a mission to ensure no patient is alone. By 2020, 90% of the world's population will have a smartphone in their hand. What are we doing with it? We want to ensure that every patient is connected to the support, education, information tracking tools they need for their best outcomes. Decades of research have shown that peer support impacts adherence, outcomes, and of course, well-being. But how do you prescribe that? How do you personalize it? How do you get it out in mass? And how do you do that privately? I'd like to tell you a little bit about Curatio. So in its simplest form, think of a private version of Facebook with a bunch of Tinder kind of sprinkled in. So what we do is we matchmake. We help patients form private circles of support with people that are at their stage of diagnosis, their life stage, their hobbies, their interests, people they can relate to. We help them form private circles of support. We surround them with curated content, education, and programs. And then we take tracking tools that are easy to use so they can keep track of their daily health. And those outcomes, those patient-reported outcomes, and the real-world evidence is what helps our partners improve care to patients. We're focused on helping pharmaceutical and specialty pharmacy companies interact, connect, and build on this real-world evidence and patient-reported outcomes. So let me give you an example. Incredible speaker in Vice President Biden and his son diagnosed with cancer. Imagine if Bo, along with that diagnosis, got a call the next day from his specialty pharmacy that not only walked him through the protocol, but said, hey, you can join others here. And that Bo could see best practices, information, education, trackers that would connect him, like we're connected here today, with a body of peers that would understand and help him what he's going through. That's exactly what we're doing. And what we're doing is quite a bit different. We look at privacy and the importance of building private circles of support. We have proprietary matchmaking and technology that help us do that. And we want to make sure that this is personalized to each patient because everyone's journey is different. We're having great traction. We have clinical evidence. We have users in 31 countries. Our clinical evidence shows that people using Curatio have better outcomes. They perform higher in 5 out of 8 standard measurements, and they're better able to navigate, they're better able to self-manage, and they have better psychosocial scores. We have users in 31 countries, which is the happiest news that I love to share. And we'll be in 4 languages at the end of this month. We are supporting over 200 conditions in 7 communities and working with pharmaceutical and specialty pharmacy companies that want to improve their support of patients. When you think about it, it's kind of ludicrous that you don't have a prescription for the social support that you need. It's cost effective. It has clinical evidence to show that it works, and it's something that's so easy to do. We are on a mission to make sure that no patient on the planet has to go through their health journey alone. I'd be happy to demo our platform for you, talk about our clinical evidence, and show you a little bit about what we're up to. Thank you.